Hi, guys. I'm Kenya Brown, and welcome to Black Health 365. Now, Black communities face unique health challenges that make access to the right care essential. Now, physical, occupational, and speech therapy aren't just for recovery after injury, they're powerful tools for long term health, independence, and quality of life. In this interview, Dr. Gregory Hall, an internal medicine physician at university hospitals, will explain how these therapies support Black health, break down misconceptions, and highlight why seeking help is a sign of strength in self care. Let's dive into what you need to know to make informed choices for yourself and your loved ones. Hi, Dr. Hall.
Hey Kenya, how you doing?
I'm doing well. I'm doing well. So let's talk. Now, why should African Americans consider physical, occupational, or speech therapy as a part of their healthcare plan?
Well, I find with my patients, if someone has a knee pain or a back pain, the best treatment is for them to go to physical therapy. But that's also kind of what they don't want to hear, right? They don't,
Right.
for some reason, they want me to give them a pill or an injection or something like that.
Yeah.
I don't know what's easier or what the situation is, but they are not excited. I can see their eyes kind of roll when I mention physical therapy, but really, I don't know if it's cultural because I think a lot of my patients that aren't African Americans kind of see that as, I don't really want to do that, but
Yeah.
it's by far the best option for back pain, for knee pain, for speech issues. And so I think we people in general tend to poo-poo the power of therapy, but it really can it really and we get it when it comes to football and basketball. They're going to have surgery, and then they're going to go through extensive therapy, and then they come back and do these amazing things, but we don't really get it when it comes to our own health.
Absolutely. And I must say that I'm guilty. A lot of us think that it's just emergency care.
Mhm.
Those things are just for emergency. If you were out playing sports or something, then you do that. But otherwise, you're just wasting your time. They're just gonna scoot you around a little bit and then you just go on about your business.
Right.
So that's but tell us the difference between physical, occupational, and speech therapy.
Well, I'll start with the last, the easiest one. Speech therapy is really related to speech, right? And also swallowing, things that your mouth sort of does. And so people will have a stroke and maybe have trouble swallowing or swallow and choke on food or choke on beverages or something, things related to
Yes.
that. So speech therapy, I tell my patient, I had a terrible speech impediment as a child. I stuttered. I had trouble with THs, S's, T's, and so a speech therapist actually was able to fix all of my speech impediments while I was in elementary school. And so when I see grown people with lisp like I had, or just can't pronounce things like I couldn't, I'm
Yeah.
thinking, boy, they really could have benefited from speech therapy, and they could still benefit from speech therapy, right? The other issue related to occupational therapy is not so much related to job therapy, but related to what you do. So, like using a fork to eat. If you have a stroke and now you're right-handed and you can't use a fork to eat, or you can't manage remote control of your TV, that would be something that an occupational therapist would help you with. Little tasks, buttoning your shirt. Something a man was telling me, he had numbness in his hand. He says, I take two buttons off and then I pull this button down shirt over my head because I can't
Yes.
button my buttons. And so an occupational therapy would help you with these little tasks that are little tasks to us, but they're big tasks to people if they have some sort of a deficiency. And so that's really occupational therapy. Physical therapy is more conventionally thought of after a surgery. If someone had back surgery, you're going to absolutely have physical therapy after that. Or if you have knee surgery or foot surgery, you're going to need physical therapy in order to build the muscle back and in order to get back to function. So those are the three main ones. But I obviously suggest physical therapy, probably in that order. Physical therapy is the most I suggest. Occupational therapy is really with stroke victims and people with with dramatic things happening in their life. And then speech therapy as an adult doctor is really, I see, more related to swallowing and people, things related to that, because they can actually help you do that. Another type of therapy people don't think about with physical therapy is their bladder. As
Mm,
women get older, they can sneeze and lose their urine, or they can cough
absolutely.
or laugh, right?
Hmm.
And men, as they have prostate problems, can have trouble with their bladder, and so they actually have physical therapy for the pelvic floor that helps you strengthen those muscles, so that when you cough or sneeze or whatever, your pelvic floor muscles can be strengthened to help you with issues with urinary incontinence.
Listen, guys, don't look past the obvious answers because some of these things can definitely. I was just familiarized with a lot of these therapies with my dad, with the speech therapy, and I didn't know, the place of all of these, but very helpful for your lives. Now, are these therapies only for people who are recovering from serious injury or illness?
Well, no, they're not, and that's kind of most people that I send to therapy are really sent because they have chronic problems. A lot of my older patients sit around, they're watching the Beverly Hillbillies and Gunsmoke all day, and they
Yes,
find I can't go up the stairs anymore. And, that would be a physical therapy move. People will come over your house and stand at the bottom of the stairs at your house. What I mean, before
yes,
coming up the front porch, because they can't do stairs because they don't do stairs. That would be
yes.
something that a person would go to physical therapy for. So, I mean, there's people just kind of lost function over time. And the same thing with the bladder, with your people think, well, I lose my urine, I'll just put some Depends on and keep it going. But there are people that can help you with that. And you just don't know about it. And you don't think that those practicing those muscles will help, but they really will.
Yeah, there's a fix for that. Now, there's a stigma in some communities about getting help. How do we get past that?
Well, I think the main way is when people hear about other people doing stuff. I think that's when they feel better about it. I know, like for prostate cancer, for example, I have someone have prostate cancer, and then they find out, most of their friends have prostate cancer. Because but people
Yes,
aren't just talking about it,
right.
because there's a degree of, I don't know, secrecy. I think, and I think that is kind of within our community more than others. And
Yeah,
so, as people talk about, I went to therapy and it helped me. Like, I actually went to therapy and it helped me with my chronic back pain. These You find that you can empower, say that happened, that experience happened, and I got better. And so I think when people don't hear about things, they it kind of empowers them. Just like people saying, I have problems with depression. That it makes other people confess, "Well, I have problems with depression too."
yes,
So as
yes,
we
absolutely.
talk about these things, we find out that what you think might be unique to you is really not unique to you at all.
Absolutely. And I must say, over a certain age, everything was kept hush hush. You kept all your business to yourself. But now for the younger folks out here, they tell everything, what they eat, what everything is going on social media. So listen, get past these stigmas. And as Dr. Hall said, you can find a big community of people that may have gone through similar things as you have and have gone through things and maybe can suggest some things as well. Now, what should someone do if they think therapy could help them or a loved one?
Well, listen, the common theme, if you listen to any of our interviews over the last couple of years, is get a primary care doctor that you like and that you trust. And I still get patients coming to me for the first time and said, I was with so and so. I was okay with him, so I didn't think I should leave, but I didn't know you spent so much time, or I didn't know this, or we were going to get along so well. So
Yes,
I think it's important to find a primary care doctor you like and trust, and let them be open to suggestions. People kind of come to us with an agenda. I got sinusitis,
yes,
I want an antibiotic. I got back pain, I want some pills. Whereas you should really go with an open mind and say, what's the
yeah,
best practice now for back pain? What's the best practice for sinusitis? Rather than, kind of feel like you were disappointed if you didn't get what your agenda was when you go to
right,
the
right.
primary care, right? And it's also important to get preventative things. If you only go when there's a problem, there's not an opportunity to kind of find out, well, do you have back problems? Well, yeah, I do, but I've been dealing with it for years. Do you
Right.
have incontinence problems? Well, yeah, but I've been dealing with it for years. So it's like that's an opportunity to say, well, what's out there? What might make this a little bit better? So primary care doctor is the key.
Yes. It's so important. You have to communicate with this person. They're in charge of your health. So you have to, well, you're in charge of your health, but you have to make sure that you can communicate with your family doctor so that you can get the right things going for you. Yes, I agree. Now, I want to thank you so much, Dr. Hall, for being with us today and talking about the benefits of therapy and your healthcare journey. As we finish, I want to remind everyone to prioritize your health by finding a doctor you trust. Call 216-714-2397 to schedule an appointment today. To learn more about our Black Health 365 program, visit wzakcleveland.com/BH365. Thanks so much, Dr. Hall.
Thanks so much. Take care.
Yes, make sure you share this video for you or someone else might need this information as well. Till next time, y'all, it's your girl, Kenya Brown at 93.1 WCAK.